pleasure to have Dr. John Kim on the show today, who's a functional medicine pharmacist. And we met last summer at the Biohacking Congress in Boston, and we had some very interesting conversations, which we're now going to record for you today. Dr. John has been in clinical practice for 15 years, promoting wellness and preventative medicine. And I really like how he jumped into the biohacking space and continues to educate himself at conferences and seminars, and then relaying the latest science and technology to his patients. He received his doctorate in pharmacy from Rutgers University with high honors and trained in functional medicine from the American Academy of Anti-Aging Medicine, A4M. He now actively lectures throughout the US and is an influencer within that functional medicine world to educate and empower everyday people to live a healthy, fulfilling life. And I love his message, which is the doctor of the future is you, the patient. And I'd love for you guys to dive a little bit deeper into that. So this is so cool. Let's get empowered and meet Dr. John Kim. Welcome.
Zora, thank you so much. I know it's been a due time in terms of being your podcast and really talk about these things, but thank you so much for your invite, and I'm really looking forward to this discussion.
Oh, we have so much to talk about. Before we do, actually, we're going to talk about toxins today, but what do you mean by the doctor of the future is you, the patient? You want to elaborate on that?
Yeah, absolutely. You know, that is one of the key things that's been really resonant in my heart for the last 3 years, basically. The reason being is, with all the pandemic response that went on and all the information, especially misinformation that's been going on, especially from the public health standpoint, from their doctors and such, people are really confused. And that's the main reason why I got into the whole social media in terms of talking about how to empower patients to make the right choices on their own, because really, at the end of it all, it's you who has to be really the expert and as well as being responsible for entire health, instead of just relying on some person with a fancy coat on, right? So you have to be very mindful in terms of how you eat, how you take care of your stress, how you poop, how you sleep, how to do everything, even how to exercise. That's something that has to be empowered. And that's the missing point that's been going on, that the people out there are so afraid of making the wrong decisions because there's been such a misinformation going on, that you have to be your own doctor, your own advocate to create a better, healthy life.
It's exactly the message that I got from Wade Lightheart, who is the founder of Bioptimizers. And he said exactly the same message. And we need to empower ourselves and not always rely on a doctor, but it takes time to educate ourselves, right? It takes work, and it's so much easier just to do whatever the doctor says without questioning. But I think that's a big mistake. And we need to really invest our time and our money in our health to have a better future. So I completely agree with you. Now, when we were discussing what topic to cover for this podcast, you said immediately toxins. And then I jumped the gun and I said, well, I am not a fan of detoxes. It's the first thing that came to my mind when you said it. And yeah. I just don't believe in these juice detoxes and fasting detoxes. It's not my thing. I'm not a big believer in them, and because there's just too much misinformation in this space, and I've seen too many things go wrong. But you made it clear that this is not what you meant by detoxing. So tell us what you really meant.
Yes. So I know anytime someone says, hey, especially beginning of the year, right? January hits and then everybody's getting to this whole health mode in terms of either doing some kind of juice detox, joining a gym, which they will never go to sometimes, right? That's the reason why the gym industry, the sales end up having to skyrocket at the beginning of the year.
And I call them donations to the gym.
That's exactly what it comes out to. And then I say, in terms of all that juice cleanse, is complete BS. It doesn't work well at all. It doesn't really fit into the needs of the person that needs to be done. Yeah, you might end up having to lose a little bit of weight, but is that really doing anything in terms of what's happening intracellularly, right? So if you look at what we are and where we are right now, in terms of the overall toxins, such as heavy metals, pharmaceutical drugs, that's a type of toxin we have to talk about, as well as mold toxins, right, which you're going to be discussing, as well as what's really prevalent these days with plastics, BPA, right? BPA has been known to causing a lot of the issues in terms of binding to the protein receptors, really downgrading over how the hormones are interacting. So all those things are really important factor that we have to talk about, but it's never been talked about at all because we don't know much. But then also the entire juicing cleansing industry, it seems like it's been taking over and just really giving the wrong information that we have to really educating the public out there that there's much more of the toxins out there that needs to be addressed rather than doing some simple cleanse. And you need to really get into the nitty gritty and dealing with the cell in itself, cell receptors, how those toxins end up having to damage the DNA, how these toxins are able to affect your hormonal balance, right? Especially in your audience where women are over 50, they want to have the longevity, they want to keep their vibrancy and also hormonal balance. Well, you got to talk about toxins, how toxins are able to affect your hormonal balance is one thing, but then also your hormones are able to work well because your receptors are downgraded based on the toxins you're getting exposed to, like BPA, right? So that's just the reason why I want to address that topic. And I think that should be the number one topic that biohackers in general should be focusing on. You can't biohack your own health if you're dealing with all these toxins. What are you gonna do? You're gonna spend thousands of dollars? Or I saw that one article that billionaire who's spending $2 million now.
Everybody's talking about him. Yeah.
And so, the funny thing was, I know it's kind of joking on the side. I was talking to Natalie Needham, our mutual friend, and I was like, wow, gosh, did Sandy Kaufman set up this entire protocol for him?
The supplement queen. Yes.
Yeah, exactly. So, joking aside, but it's just, that's the drastic side that people are trying to get. They want to buy their own health. You don't have to, right? The entire biohacking seems like it's been such a reach for the rich. Well, I don't think so. I think the people, regular people in general, are able to empower themselves to create their own biohack. You know what? The first thing you should do is to do that detox I'm talking about today.
When I read that article, I actually didn't read the whole thing. I skimmed through it, but he totally lost me when he says he wakes up at 5 a.m. I was like, okay, the guy's not getting his sleep. Like the most basic thing. I'm sorry.
Yeah.
But you're absolutely right. I agree. There's so much foundation. There's so much education. There's so many things that we should be doing that are free, that don't cost anything, that really, that before we get to those biohacks. And the problem with the word biohack is that everybody wants that quick fix, that one hack. And as you've explained it, and I explain it, is just there's a lot more going on, and we need to really take care of certain foundations first. Not that those biohacks or those things don't work; they just don't work as well, or they don't work at all if you don't have those really basic foundations. And one thing you mentioned, I really am excited to hear about is you're going to tell us about BPA and mold and these kind of toxins. And I'm just launching my energy reboot program for women 50 plus. That's coming out in February 25th. And I have sections on that and how that disrupts hormones and how that affects your health in general. So I'm really excited to hear what you have to say about that. And then we'll have to get you on to as a guest speaker too in the next cohort.
Absolutely.
Yeah. So then how do toxins like these mold and heavy metals and BPA, I don't know if what are the differences in how they affect the hormones of a woman going through midlife or menopause? And we have these crazy fluctuations anyways. So how are they being affected?
So, that in itself, let's go far out. Let's look at the entire forest and then having to really get into the nitty gritty in terms of looking at the tree in itself. So toxins in general, how what it is. We're basically living in a cesspool of toxins and all the things. And the things that are really getting exposed to nowadays, we haven't been exposed to 100 years ago. So in terms of your mom's DNA and her mitochondrial function, right? We always talk about mitochondria, how to optimize these things. But a mitochondria in itself, that what your mother's mitochondria has been passed down to you is far different in terms of what you're passing on to your daughter. I think you have a daughter, right?
Yes.
Yeah. So why is that? It's because of the overall epigenetic change that's been happening because of the 100 years of changes that went on with the toxin exposure that we've been getting right now. So we just talked about BPA. We talked about mold toxins. That mold toxins is a whole different thing because mold in itself, I mean, our nature is comprised of mold and funguses. That's our entire microbiome ecosystem that we're living in. However, mold in itself, when it senses certain danger, that end up having to release mold toxins, which can be very detriment to human health to a point in terms of it's affecting the immune system, it's causing heavy amounts of Th1 to Th2 imbalance, on top of the fact that there's much more greater issue dealing with how those mold end up having to come into play with heavy metals. And now you're dealing with the entire cesspool of toxins in your body. And now your hormones are completely out of whack. You're getting to develop these type of autoimmune disorders, and then heart conditions, and etc. So again, biohacking is great, but if you're dealing with all those toxins and having to deal with the overall epigenetic changes that went on for the last 100 years, how are you going to optimize your health? Or better yet, how are you going to hack your health when you're dealing with these things? So the first foundational aspect that we have to talk about, and this is the number one mistake that I made for the past probably 10 years, because I've been more diving into this type of toxin issues for the last 5 years. For the past 10 years, I was dealing with just optimizing patients' hormones. Get the saliva test done, recommend the overall bioidentical hormone replacement therapy that could be customized for the patient, and then looking at the adrenals and then giving them supplements. Well, the problem was that patients, probably about a good amount of patients would do well, but then there are about 30% of patients who don't do well with these type of hormones because of toxins. And I didn't realize how that is affected because, again, epigenetic changes going on, your microbiome is completely messed up because of the entirety of the different ecosystem coming into play. Again, mold, parasites, virus, right? And then different bacteria in your gut that's also affecting your overall hormone metabolism and how the hormones are being affected in your receptors. And then your liver is not able to detox your hormones as well. And so you have an over influctuation of bad toxic hormone byproducts that could be coming into play. And then that in itself can cause other issues in your body as well. So what I'm trying to say basically is that instead of just looking at the hormones and just really focusing, and this is what's happening in the biohacking industry, rather than doing that, let's create a clean terrain first, and then having to apply the hormonal aspect of it, and then really focusing on what the person needs. I think that's where the overall customized foundational aspect that we have to focus on, rather than just looking at hormones.
So then would you be recommending everyone to do tests for toxins before they go on their hormone or bioidentical hormones, or just those 30% you go, it doesn't seem to be working them now, let's test them?
Yeah, that's a good question, because from looking at it now, I think everybody should be checked for toxins. I mean, if you decide to do a total toxic burden testing, usually it could be costing you, cost-wise for the lab-wise, it's around $600. So it's not as bad as sometimes you're spending $1,000 on some kind of other peptides and other things. And so you're looking at the entire health, right? And I know biohackers are really good on taking and looking at labs. Well, this can be part of your overall lifestyle and just looking at these things. And those type of total toxic testing is not going to just looking at heavy metals. It will be looking at environmental toxins such as glyphosates, looking at pesticides, and also PFAS, right? Those forever chemicals that's being lodged into your cells. And then as well as looking at different set of mycotoxins or mold toxins, because certain mold toxins could be much more prevalent in food that you eat, like aflatoxins. And then there are certain toxic mold that are much prevalent in a wet building where there's mold that's growing, and that could cause much more illness, like citrinin as well as Stachybotrys and trichothecins. Those are different type of mold that can be affected as well. But these are all things that can affect your metabolism and how your receptors are working within your entire hormonal system.
Okay. So then, yeah, it's probably wise to do the include that in all the other testing. But is this something that insurance covers? Like, how does because some people get their blood work covered? Is this kind of a testing covered by that?
Yeah. So the right now, depending on where your listeners are listening from, those type of functional toxic testing might be available through their labs, but it's not very sensitive to check all those things. So if you could work with a functional labs, like companies like Vibrant Wellness, Great Plains, that might be available even in Europe as well. And those companies do very well in terms of getting to the nitty-gritty science of looking at different toxins and really laying these things out. And really easy for practitioners or even patients to even looking at in terms of what they're dealing with. And that could be costing, again, it's not covered through insurance, out-of-pocket expenses close to around $600 to $800, depending on the lab company you're looking at. And then there are additional costs probably looking to work with a practitioner. But it's not as much compared to what you're going to be spending even more money on trying to figure out what else is going on with you, right? I like to talk about the terrain as being one of the things that our body itself is a terrain, right? Our body is filled with different microbiomes and enzymes and such. But in order for them to work optimally, excuse me, they need a clean slate of toxin not being exposed to them. Because even if you're looking at mitochondria and microbiome, all those things are, working together, right?
Explain maybe what mitochondria is for some people who may not.
Sure, absolutely. The mitochondria is basically a small organelle or little tiny being inside your cell to create energy. The main objective job for mitochondria is to create energy. However, when mitochondria is such a sensitive little thing where if you're dealing with certain toxins and certain stressors, even post-traumatic experiences as well, can actually affect the mitochondria to function well to a point that's becoming dysfunctional state. And when the mitochondria sense a certain danger of that nature, such as BPA and mold toxins and even heavy metals, the mitochondria undergoes a process called cell danger response. So it just shuts down. It creates a immunological effect of inflammation to becoming a fighting mode, right? It becomes a fighter. The issue is that the body's not able to handle these things well. As a result, you have different disease states coming through, such as autoimmune disease, hormonal dysfunction, right? Gut dysbiosis, neurological issues. All those things are related to improper cell danger response that went on because of the mitochondria being affected because of these toxins.
I'm so glad you cleared that up, and you talked about the danger response because some people, well, I think most people, if you know what mitochondria is, we associate it with creating energy and ATP, and this is why I cover a lot of this in my program. But a lot of people don't know about that other function. The cell has many functions, but another very important function is that cell danger response. And I saw that you have a video actually of on that, which I think maybe I should put a link to that so people understand that. And that's the body and the mitochondria detecting, yeah, there's a toxin or there's a problem or there's a virus, there's a bacteria, there's something going on. And then when it is in that, it cannot create energy and do well and help the body function well and fight a toxin at the same time. It's like one or the other. And so when we are in the danger response, that's when we feel fatigue. We feel tired, right? And that's the body sort of shutting it down, trying to fight whatever it is. So it's a good thing actually to be tired in that sense because your body is trying to fight something. The problem is it like constantly activated fighting this toxin that is appearing. And this is where you can come and explain a little bit then what are the clues that a woman in her 50s, more or less, what should she looking out for than maybe fatigue, that gives her a clue, what maybe I should test my toxins, maybe this is mold, maybe this is heavy metal, or maybe this is plastics. And how do we know? And it can be probably is coinciding a lot with the perimenopause symptoms or menopausal symptoms. So how do we know it's just loss of our hormones, and how do we know it's actually a toxin and we should go test?
Absolutely. So hormone testing, I prefer saliva. There are companies like Dutch or ZRT Lab. Those are good two companies to really look into. That's the first step. The second thing is you have to look at what symptoms you're dealing with. We're not some kind of a number that we have to follow through. And this happens to be the case with clinicians, where they're just looking at numbers, not looking at the person's entire as a whole as a symptoms they're dealing with. So symptoms are very, very important. So first thing that I would probably end up having to ask is, are you able to poop well? Right? And that's one of the key things I talk about, this thing called drainage pathway. So drainage pathway, looking at your entire piping system, your liver, your gallbladder, your colon, and then as well as your kidneys. The four main points of the entire drainage pathway should be, actually, fifth one would be sweating. So if you don't sweat well, that's a problem too. So 5 things that we talk about right now. So if you're not able to sweat well, if you're not able to poop well, if you're not able to, if you're constantly having to deal with, white filmy poop that you're excreting because of your fat is not able to absorb that well, that means that your gallbladder might not be working well, right? You're not producing enough bile, especially, right? And then on top of the fact that if you're constantly having these type of different UTI issues or other bladder problem, yeah, there is a constant issue with your drainage pathways. The first thing is I actually ask is, are you able to poop well? Are you able to sweat well? If you're not able to sweat well inside a sauna, and I've seen patients where they're able to sweat from bottom down to their feet, but they can't sweat anywhere around their forehead. That's a big problem, right? Or if you're constantly having to deal with the fact that indigestion of food, that you are able to get bloated after eating certain food or such, that is a clinical sign of some kind of toxins getting involved, microbiome imbalance, as well as other deeper rooted issues like parasites, right? Parasites everywhere. We are living with them, but the thing is, they could cause havoc in terms of all the things that's going on. So if that is the number one thing that are seen, and based on the clinical diagnosis and what the patients show as in front of me, then I would recommend doing certain other tests, such as a total toxic burden testing, even looking at stool testing to looking at what are they dealing with, and then generally looking at the other lab markers and inflammatory markers to see what we could do to look at the root cause issue and fix the root cause while addressing the hormonal imbalance the patient might be dealing with. Because if you could get rid of the toxins, patients do better. They may not even need hormone replacement therapy. And this is a key thing. I end up having to make a mistake. Back in the day, I thought hormones were the entire thing. No, hormones are just the bottom of the picture. What we have to look at is the root cause, which is the top, or maybe the other way around. But you have to look at the entirety of the issues first, instead of just hyper-focusing on what the problem is, which could be signs and symptoms of hormonal dysfunction.
But how would then you differentiate? It wouldn't be unusual. I mean, I think it's common that women going through menopause have digestive issues, possibly due to anxiety and stress, the change, the fluctuating hormones, and psychological issues of how a new purpose in life, and so many other things why they may be stressed and then not able to poop well. And then it wouldn't be unusual to have vasomotor issues, the hot flashes and things like that. And that's from the change in the hormones. No, are you saying that could not be just the hormones itself, but the toxins that are affecting the hormones that are giving this, and so replacing the hormone or improving the hormonal function with hormone therapy may not be enough? Did I understand that correct?
Correct. And that's where majority of patients will do well absolutely not doing anything, as long as they have a clean diet, they have to exercise well, they're constantly moving around, they're able to sweat daily, they have to poop daily. That's fine. But there are a group of patients who are having these type of troubleshooting issues where they're not able to have a proper drainage pathway that's been widely open. And they have trouble sleeping, even though it might be addressing with certain sleeping pill or even optimizing their progesterone, for instance, because progesterone actually does help with sleep. And they still end up having to wake up middle of the night. Their blood sugar levels constantly being out of whack. or they have to deal with this type of heart palpitation. That's one of the common things that can occur with different toxins. And so those things that have to looked at, it's a really individual approach. So it could be very difficult for patients, but if you are one of those patients who are not able to get all the answers based on just looking at some of the biohacking methods or just looking at hormones, the much bigger picture they have to look at. There's an underlying root cause issue where there are toxins getting involved, such as mold toxins and different things, that you shouldn't be just focusing on just one issue, but looking at the person's history, how they got exposed to certain things. So I have a general 14-page assessment sheet that I end up having to give to patients just to get a picture of what they're dealing with, and then having to say, hey, you know what? These are things that we're seeing right now. These are things that you're complaining of. Let's look at deeper. Let's order the right labs, and then having to get the right issue in place and then address it properly. Because if you don't, your hormone's not going to be fixing all the issues. You're going to still end up with a complaint about, oh, I'm still not able to lose weight, right? That's the number one thing that they probably say. Oh, I feel very sluggish. My thyroid number is completely off, right? I end up having to have a very smelly bowel movement, or I cannot sweat that well. I have horrible body odors coming through if I end up to deal with certain exercise. So all those are signs and symptoms of different toxins. And then if you're dealing with serious matters like autoimmune disorders, yeah, there's a definitely shift of different immunological issues like Th1, Th2 imbalance, which can be caused by, such as BPA, I just mentioned before, but then also certain heavy metals, such as mercury can cause that as well. So all those things have to be looked at. So even looking at hyperfocus on just mold toxins, what we kind of talked about even before we got into this, that toxins should be looked into in a grander scale of the person's therapy rather than just hyperfocusing on hormones. Hopefully that makes a lot of clearance for listeners out there.
No, I think that makes perfect sense too. So you talked about total toxin testing and because it seems the biggest ones that you kind of mentioned, heavy metals, BPA, and plastics, and mold. So are you saying would somebody get this total test? Is this like one test that does it all, or do they have to go individually based on what you think? Oh, could be a mold problem. We're going to test for that. Forget the spending the money on the heavy metals and the whatever it is, or explain how that works if somebody suspects a toxin issue.
Yeah, absolutely. So we did talk about how all different toxins like to be in a cesspool of toxins. They like to just play together. They roam around together, right? So this is an analogy that, you have a 130 kid, you're going to have a second 30 kid roaming around together. So that's how you have to look at these things. You could order individual testing, but if you end up having to combine it together, that's a better picture looking at entirety of your issues you're dealing with. That's what I've been mentioning about. And another thing is, if you combine all those labs together, usually the functional lab companies, they tend to give you discounts anyway. So why not take advantage of the matter? And I'm really looking at, all right, so I'm doing it with heavy metals, then I should be looking at mold toxins, or I should be looking at some other environmental issues such as glyphosates. And glyphosates are probably number one thing that can cause gut dysbiosis, because it wreaks a havoc, causing leaky gut. It destroys the expression of your overall natural microbiome or flora that's in your gut in itself. So if you have been eating a lot of food or processed food or all these chemically laced food, you're going to be exposed to glyphosate. So
maybe you should explain a little bit what a glyphosate is.
Sure. So glyphosate, I sometimes have to kind of, take things even more simply. So sorry about that. But my apologies for the listeners. But glyphosates are basically known as Roundup. It's a pesticide that's been used widely in food for the past, 50, 60 years. And what they're noticing and what they found out was that it's been linked to cancer. So these are the not natural, but the chemical toxins that we're constantly exposed to. We have trouble getting things out properly. And if depending on your overall, again, epigenetics, epigenetics means that certain lifestyle changes, environmental factors, certain psychological traumas, and including your genetic, all coming into play and causing or actually affecting how your body is actually being expressed as being a healthy person or unhealthy person, right? So glyphosates can actually cause a change in your epigenetic profile. And this is where the customized biohacking aspect of it is coming into play. We're not just looking at the genetics, because genetic in itself is just a loaded gun, right? And this is what's triggering it is your epigenetic aspect in terms of your overall lifestyle, what you've been eating, how you've been dealing with stress, right? What your overall lifestyle has been, and as well as different toxins that you're getting exposed to. All those things can actually cause a epigenetic changes. However, when you're dealing with glyphosates, it causes a epigenetic change to cause cancer and other serious matters in your health. So when you're looking at a total toxic burden, yes, you have to look at the entirety of it and looking at it. And there's much more toxins out there, but those are the major things that we should look at to get a general picture of your health.
So where can somebody find a test like this? And I'm assuming they need a doctor to interpret it, and probably not just a normal doctor, right?
Yeah, that's the number one thing. So I don't know if it's a good time to even offer this deal for your listeners out there, but as a gift for all the listeners, I am giving a $89 discovery call deal for people to talk about what their health is, and as well as talking about total toxins and looking at these things. So you don't have to work with me. That's just a free gift. I mean, basic gift for people out there, but you have to work with a right functional a doctor or integrated practitioners, right, in your area to order these things and talking about it in deeper. Regular MDs and DOs are not going to be able to be knowledgeable about these things. Matter of fact, they probably say it's all in your head. So working with a functional medicine provider or integrative specialist would be the better bet. And then talking about what the symptoms you're dealing with, and then having to get the right labs ordered.
Oh, cool. Okay. So people can contact you and get a free 20-minute call and just ask questions and stuff. Is that?
Yeah. So this is a discovery call.
Yeah.
So
Where do we get that?
So there was a deal that I was going to, as a gift for people. It's a $636 value. But as for listeners out there, I'm giving you that for $89. It's a basically a 30-minute discovery call to see, and I give you all the tools. I give you intake, fill out that 14-page issue dealing with your physical assessment, including toxin exposures. And then within that 30 minutes, we end up having to looking at what can we do to help you optimize your health. So I'm just the one person, but obviously if you are looking to find a local person out there, right, that would be the better bet to really looking at how can we optimize our health based on what kind of toxins you're dealing with.
Oh, okay. That's really great. So I'm guessing they can go to the website, drkimwellness.com, right? And find that,
Yeah,
or are you going to send me?
I even gave you a link there on our.
Oh, great. Oh, yes,
Yeah,
you did.
so,
I got
yes.
a link. You're right. I'll put that in the show notes. So that's great. Okay. So say someone's, okay, we got to take a test. All right. We get the toxin test, a total toxin test, whatever that is. And how it's done with saliva, or how is that done normally? Or is it different tests to different ways?
No, it's a simple urine testing.
A urine testing. Okay.
Yeah.
So they take the urine test, they pop in the mail. Several weeks later, I guess, they get some results. You have an appointment with them, or a functional medicine doctor gets them back, interprets the results. Now, what happens that they have heavy metal toxins, but maybe not pesticide. I mean, I don't know, maybe plastics or something. What do they do? What's the next step? Somebody's got toxic load, toxic burden. What would normally, I know maybe it's different patient to patient, but what would you often see maybe especially in this population of women around the age of 50 going through menopause? What are you seeing, and how do they treat it?
Yeah, absolutely. So once we've identified that, first thing we have to do is setting an overall foundational aspect in your health. So two things I end up having to focus on. One is your cell membrane health. We'll go through that a little more. So that's one. Number two is focusing on your overall drainage pathway. you're not able to detox already to begin with, then you're not going to be able to detox the things that you already identified. So those are two main focus I end up looking at. So what does a drainage pathway look like? I just mentioned about the 5 things, right? You have to sweat, you have to poop, you have to be able to pee well, you have to digest fat properly, so overall bowel support and your gallbladder, and then your overall colon. So all those 5 things should be working well. If you're not, then we have to address that first. Then we're able to, I give the patients a very easy analogy. If you have a very much of a clogged bathtub and you have dirty water already on top of and inside the bathtub, no matter what you do in terms of getting all the dirty water out manually, you're not able to get the entirety of your plumbing well flowing through because you have a clogged plumbing. So you have to get things manually pushed through. Well, there are certain things, certain supplements, certain ways in terms of cleaning you out to get the things flowing. So for instance, if you are heavily constipated constantly, right, because you have a low thyroid function, or maybe you're dealing with some of the toxin that's causing that, well, we're going to give you certain motility agents as well as other things to get this flowing. So that should be number 1. If you are not able to digest fat that well, right, if you actually have a stool that's coated in white film or just very foul smell, well, you're not able to produce enough enzymes and bile that you're able to, you're causing this issue. So you might have to start taking some ox bile. Tutka is another great supplement to take. That is in itself to help to digest fat and get your bile flowing. And then also right off the bat, you have to support your liver. So into supporting phase 1 and phase 2 metabolism, you're taking supplements and herbals to support that. And then as well as other herbals to actually support the kidney function as well. So all those things are coming into play to get the drainage pathway opened up. Then,
can I ask you, then
sure.
would you ask them to also change their diet and lifestyle, or they can just manage with that with just a supplement?
No supplement. You can't just do the supplements without implementing the lifestyle. So first thing I do is address the 2 things I mentioned before. And then the underlying foundation aspect that I end up having to recommend is doing more of a keto / paleo diet, getting rid of all the food that's going to be causing a lot of allergic response or inflammation. So especially inflammatory oils, that's number 1 that I get rid of. Gluten, casein, right? Corn is full of toxins sometimes, depending on how you buy, either organic or inorganic, as well as all the things like soy. Okay. So all those things are coming into play to give you a clean slate of foundation. You have to start moving, right? If you're complete sedentary, you're not moving that well, that could be another problem as well. So having to deal with that could be a bigger challenge for people. And then as well as, are you sleeping well? If you're not sleeping well, if you're only getting 3 or 4 hours of sleep, well, you're not able to detox well, because especially the toxins that could be coming into your brain, well, the brain's able to recycle that, or at least to get things out when you're sleeping. So if you're not doing that, that could be another problem. So there's multiple areas that we have to looking at. That's just a foundation. Then you have to address the 2 things I mentioned before, the drainage pathway, and the second thing will be looking at the cell membrane health. So that's a good segment to going into what is cell membrane. Well, your entirety of your cell is comprised of different fat membranes to allow your mitochondria to function well. The issue is that when you're dealing with different toxins, those toxins actually causing a cell membrane damage. So what simply put is that this could be even more difficult to understand sometimes, but when you're going through a cell danger response, what the mitochondria does is, because of the sense of danger, it starts to pump out all these lipids and different inflammatory cytokines in your cells. And what that causes, it causes a cell membrane to get completely locked to prevent further damage that could be spread onto different cells. The issue is that in itself, the overall lipid reserve that we might be having in our body can get depleted because of the chronic inflammation and the mitochondria being in a dysfunctional state. So that's why we have to address the cell membrane integrity even before we're able to do anything else. So that should be the two things I address: cell membrane aspect of it by adding in the healthy lipids, so namely phospholipids, and as those different bioactive oils, and then as well as addressing the drainage pathway in terms of how the person is able to detox well.
I'm also guessing you'd probably, I don't know if the assessment or somehow you'd figure out if somebody's living in a home with toxic mold as well, because you could be taking all the protocols that you ask, but if they're living in this environment, it just keeps perpetuating, I guess, right? They don't suddenly become immune to the mold that's growing in their basement or their bathroom. And it may be the same thing with plastics. I guess you're telling them to maybe skip the bottled water, plastic bottles, or the little plastic top in your Starbucks coffee, heating up that little plastic and dripping into your tea or whatever it is. So there's probably a lot of just lifestyle things you need to cover as well, that people need to be aware of. And we talk a lot about this in the program as well, and just to bring that awareness so that people can start practicing, because if you don't know that's causing your problem, or like you mentioned some chemicals and toxins maybe in your personal care products. Some people are more sensitive and some people are less, and their detox pathways seem to be managing just fine, and other people aren't. So are you discussing things like that with the patient?
Yeah, absolutely. So first thing, you need to have a clean terrain, I mentioned before, right? So terrain, not even just the inside, but the outside. So you have to looking at what exposure of toxins you might be dealing with at home. So food is number one. Number two is your living space, even including your workspace as well. But your living space wise, is there any signs of leaky basement or leaky ceiling that could be doing that? Do you see any discoloration of your walls, right? We're kind of going to now mold toxins. Have you had any home that's been built back in the before 1950s? There could be exposure of mercury or lead-based paint, right? That could be another thing. And then as well as, do you have a clean water source you're getting in your house? Is your water filtered, right? That's some of the things that you could have to looking at. Is your piping system, how old is your piping system? That needs to be upgraded as well, right? So giving a good example is my overall building that I was occupying before, when my business was, that building was built back in 1776. So all the piping system and including the infrastructure is very old. Well, I didn't realize that the entire structure was covered in black mold. Wow. Until something serious happened into one of our employees' health, that we ended up having to look at more of it. Thank God we got out of that building. We got to a new, fresh building at this point in time. But that's how serious matter it could be, because someone's health could be affected, not knowing what's causing it. So this is one thing. And the second thing is, I actually had a heart attack from mold toxins.
Wow. Really?
Right. So I actually had a perfect scenario. I had a Bartonella infection from a tick bite, mold toxins, Epstein-Barr, mycoplasma pneumoniae, and then heavy metals. Those are becoming very prevalent these days, and for the patients that I work with. But I didn't know how bad it was until I had my own health challenges. I actually had a heart attack. I had an 85% blockage in my main artery at the age of 33. And then trying to figure out what the cause was. And then I found out that, yes, I was dealing with a heavy issue with mold toxins because my parents' house was very moldy, right, growing up. And then we thought it was a simple thing, and says using bleach to clean up was a good thing to do, but that's not good. Causes more problem. And then I just had a very, very much a standard American diet. And I thought I was eating healthy, but that wasn't the case. And then when you're dealing with other biotoxins and then all the hidden infections, those can actually cause a perfect scenario, not just causing a heart attack, but other health complications that the patient might be dealing with. Wow. So you have to look at these in a bigger way. So that's the reason why I say, even in terms of getting all these, even if you decide to look at the toxins and knowing what that is, that's just the start of it, right? Talked about the drainage pathway, the cell membrane. That's the second part. The third part you have to look at is, are you living in a clean environment? Because if you're not, your body in itself, your body knows, your body is so intuitive. Your body knows that it's sensing a danger. Cell danger response goes to the entire body. They cannot calm down to allow you to heal properly. And this is the things that people don't realize, that if you're having issues, you have to identify it, but then also you need to be aware that you need to walk away, or you need to fix it. You need to fix the issue. That means that fixing the environment. That's how important that is to creating a right healing response in your body.
Wow. There's a lot to do, but it's worth it. I think
it is.
It's not just popping a supplement or something. It's really looking through all of that. And I trust that you would go through your clients like that. You mentioned that's what you do. Hopefully, if anyone listening finds another functional medicine doctor, please, I hope they're going through those motions too. So before I let you go, I would like to open the mic to see if Michaela wants to ask any questions or has any comments. It would be great just to hear. You don't have to turn on your video. You can unmute if you'd like, or type it in the chat, any questions or comments, and we'll be happy to address them. And if you're driving, it's possible you can't do any of that, and that's no problem too. So what we'll do now is I'd love to tell people where to find you. You're on Instagram at dr.john.pharmd. It's PHARMD. You're also on YouTube, Dr. Kim Wellness. Go check out that danger response video for the mitochondria, and your website, that's drkimwellness.com. And I will make sure to have in the show notes as well this link to that special offer. Is there any last words you'd like to tell a woman over 50 or something I've missed?
I think we went over a lot of stuff, but one of the things that I encourage people, especially for females out there over 50, is to create a healthy, loving life by taking care of yourself properly, right? You got to eat well, sleep well, you got to poop well, you got to de-stress well. So all those things should be done to create a healthy life. So that's one thing that I encourage. And then one of the things, lasting words, the doctor of the future is you.
Oh, what a great ending. Thank you so much for coming on, and I will hopefully have you on again. Take care.
Thank you. I appreciate it.